Welcome to our channel, everyone. Today we're taking a deep dive into a critical health concern that affects millions worldwide: hepatitis. Hepatitis, simply put, is inflammation of the liver. Now you might be thinking, why should I care about my liver? Well, your liver is a powerhouse organ responsible for filtering toxins from your blood, digesting food, and storing energy. When it's inflamed, it can't do its job effectively, and that can lead to a cascade of health problems. In this video, we'll break down the different types of hepatitis, explore their causes and symptoms, and discuss the steps you can take to protect yourself and your loved ones. We'll cover everything from prevention strategies to the latest treatment options, empowering you with the knowledge you need to make informed decisions about your health. Let's start our journey by understanding hepatitis A. This type of hepatitis is caused by the hepatitis A virus, or HAV for short. HAV is a highly contagious virus, but thankfully it typically causes a mild short-term illness. So how do you get hepatitis A? The most common route of transmission is through consuming contaminated food or water. Imagine this: you're traveling to a new country, excited to experience the local cuisine. You order a delicious-looking salad from a street vendor, unaware that the vegetables were washed with contaminated water. That's all it takes for the virus to enter your system. Now let's talk symptoms. After an incubation period of about 2 to 6 weeks, you might start experiencing flu-like symptoms. Think fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, and jaundice. Jaundice, by the way, is the yellowing of the skin and eyes, a telltale sign of liver dysfunction. The good news is that hepatitis A usually resolves on its own within a few weeks without any long-term complications. However, it's still essential to see a doctor for diagnosis and supportive care. Now let's talk prevention. The most effective way to protect yourself from hepatitis A is through vaccination. The hepatitis A vaccine is safe, effective, and highly recommended for all children and adults, especially if you're planning to travel to areas with poor sanitation. In addition to vaccination, practicing good hygiene is crucial. Wash your hands thoroughly with soap and water after using the restroom, changing diapers, and before handling food. Be mindful of food and water safety, especially when traveling. If you're unsure about the water source, opt for bottled water and avoid ice in your drinks. Remember, knowledge is power when it comes to your health. By understanding how hepatitis A is transmitted and taking the necessary precautions, you can significantly reduce your risk of contracting this virus. Now let's shift our focus to hepatitis B, a more complex form of viral hepatitis caused by the hepatitis B virus, or HBV. Unlike hepatitis A, HBV can cause both acute and chronic infections. Transmission of HBV primarily occurs through contact with infected blood and other body fluids. Think about it: sharing needles, getting a tattoo, or piercing with unsterilized equipment, or even coming into contact with open wounds or sores of an infected person can put you at risk. Now, here's where it gets tricky. Many people with acute hepatitis B don't experience any symptoms, unknowingly spreading the virus to others. However, when symptoms do occur, they can be similar to hepatitis A, including fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, and jaundice. Chronic hepatitis B is a silent threat. Over time, it can lead to serious liver damage, including cirrhosis, liver failure, and even liver cancer. That's why early detection and treatment are crucial. The good news is that we have a powerful tool to prevent hepatitis B vaccination. The hepatitis B vaccine is safe, effective, and recommended for all infants at birth, as well as older children and adults who may not have been vaccinated. In addition to vaccination, practicing safe sex by using condoms consistently and correctly can significantly reduce your risk of HBV transmission. Avoid sharing needles or any drug paraphernalia. If you're getting a tattoo or piercing, ensure the establishment follows strict sterilization protocols. Remember, hepatitis B is a preventable disease. By getting vaccinated, practicing safe sex, and being mindful of blood and body fluid precautions, you can protect yourself and others from this potentially life-threatening virus. Let's delve into hepatitis C, a viral infection caused by the hepatitis C virus, or HCV. HCV is primarily spread through blood-to-blood contact, and it often progresses to a chronic infection, silently damaging the liver over decades. Imagine this: You're getting a blood transfusion, a seemingly routine medical procedure. Unbeknownst to you, the blood supply hasn't been screened for HCV. That's all it takes for the virus to enter your bloodstream. Now, here's the concerning part. Most people with chronic hepatitis C don't experience any symptoms for years, even decades. They might feel perfectly healthy while the virus silently wreaks havoc on their liver. By the time symptoms appear, such as fatigue, jaundice, abdominal pain, loss of appetite, and swelling in the legs and ankles, significant liver damage may have already occurred. Chronic hepatitis C can lead to serious complications, including cirrhosis, liver failure, and liver cancer. It's a leading cause of liver transplants in the United States. While there's no vaccine for hepatitis C, the good news is that we now have highly effective antiviral medications that can cure the infection in most cases. Early detection and treatment are key to preventing irreversible liver damage. So, how can you protect yourself from hepatitis C? First and foremost, avoid sharing needles. If you use injection drugs, seek out harm reduction programs that provide sterile needles and syringes. Be cautious about getting tattoos or piercings, ensuring the establishment follows strict sterilization protocols. If you have any risk factors for hepatitis C, such as a history of injection drug use, blood transfusions before 1992, or birth to a mother with hepatitis C, talk to your doctor about getting tested. Remember, hepatitis C is a treatable disease. By understanding the risks, getting tested, and seeking prompt treatment, you can prevent serious liver complications and live a long, healthy life. Let's now explore hepatitis D, a unique type of viral hepatitis that only affects people already infected with hepatitis B. It's caused by the hepatitis D virus, or HDV, which needs the presence of HBV to replicate. Think of it this way. HBV is like a car and HDV is like a passenger. HDV can't drive on its own, it needs HBV to give it a ride. HDV is transmitted through contact with infected blood and body fluids similar to HBV. This means that sharing needles, having unprotected sex, or coming into contact with open wounds or sores of an infected person can put you at risk, especially if you're already living with hepatitis B. Now here's the concerning part. Hepatitis D can be severe and progress rapidly, leading to more aggressive liver damage compared to HBV alone. People co-infected with HDV and HBV are at a higher risk of developing cirrhosis, liver failure, and liver cancer. The good news is that by preventing hepatitis B, you automatically protect yourself from hepatitis D. Vaccination against HBV is the most effective way to prevent both infections. If you're living with chronic hepatitis B, talk to your doctor about getting tested for hepatitis D. While there's no specific treatment for HDV, managing your HBV infection with antiviral medications can help slow down liver damage. Remember, hepatitis D is a serious but preventable infection. By understanding the risks, getting vaccinated against hepatitis B, and practicing safe sex and blood precautions, you can protect yourself from this potentially life-threatening virus. Finally, let's shed light on hepatitis E, a viral infection caused by the hepatitis E virus, or HEV. HEV is primarily spread through contaminated water, posing a significant risk in areas with poor sanitation and hygiene. Imagine this. You're traveling to a developing country and you unknowingly drink contaminated water. The virus enters your system, potentially leading to an unpleasant experience. Hepatitis E typically causes an acute, self-limiting illness, meaning it resolves on its own within a few weeks. However, in some cases it can be more severe, especially in pregnant women. Symptoms of hepatitis E are similar to other types of hepatitis, including fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, and jaundice. The good news is that hepatitis E is preventable. Ensuring access to clean drinking water and practicing good sanitation are crucial steps in reducing the risk of infection. When traveling to areas with poor sanitation, be cautious about the water you consume. Opt for bottled water, avoid ice in your drinks, and be mindful of food safety. Wash your hands thoroughly with soap and water after using the restroom, changing diapers, and before handling food. Remember, hepatitis E is a global health concern, but by taking simple precautions, you can protect yourself from this potentially debilitating virus. That brings us to the end of our comprehensive guide to hepatitis. We've covered a lot of ground today, from understanding the different types of hepatitis to exploring their causes, symptoms, and prevention strategies. Remember, knowledge is power when it comes to your health. By staying informed about hepatitis, you can make empowered decisions to protect yourself and your loved ones. If you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Thank you for joining us on this journey towards better liver health. If you found this video helpful, please give it a thumbs up, share it with your friends and family, and subscribe to our channel for more informative content. Until next time, stay healthy and take care of your liver.